Good afternoon, all. Welcome to Game for Students. Before I start my topic today, I have one question to you. How many squares are there in this chessboard? How many squares are there in this chessboard? There is a mail ID given towards the end. You can mail me your answer. The topic for the day is lipoma. This can be a gross specimen kept for Viva, description or slide, or microscopy itself. As the name implies, the suffix oma means a benign tumor. Lipoma is a benign tumor that arises from the adipocytes. On the screen, I am seeing a large tumor, which is somewhat dorsoventrally flattened, slightly irregular, yellowish in color, and capsulated. The most important word will be capsule. And why do I say there is a capsule? Because these are all some blood vessels that I can see, which are there in the capsule. Otherwise, it is transparent and I'm seeing an yellowish tumor. It can vary from a few centimeters to several centimeters in diameter. Here again, there is a cut surface of the tumor, which is yellowish, shiny, greasy, and solid. And here also I am finding some gray-white glands, which are fibrous strands which are separating it. Externally, there is a capsule. So lipoma, benign tumor arising from the adipocytes, yellowish in color, well capsulated, homogeneous, and shiny. A lot of adjectives are there. You people can describe it by yourself. And this is the microscopy. This slide is again kept for you, undergraduates. The tumor is composed of sheets of, look at the word I am using, sheets of large, round cells. The cells are round and they are empty looking because of a vacuolated cytoplasm. The nucleus is not seen, it is pushed towards the periphery. And why is the cytoplasm vacuolated? It is because the fat is dissolved by alcohol during tissue processing. So this is the description of the tumor, not sufficient. For us to make a definite diagnosis, there has to be an external capsule. Here I am finding a fibrocollagenous band, which is the capsule, and that is surrounding the entire tumor. And there are some fibrous strands with blood vessels. Forget that. So cells are homogeneous, no areas of hemorrhage or necrosis, vacuolated cytoplasm, and peripherally pushed nucleus. Externally, there is a capsule. This incidentally is important for us in the topics on fatty liver as well as a lipoma, a cryostat. I'll tell you what this is. It is an instrument used for section cutting. And here is where the knife is. So as pointed out, so this is where we keep the tissue and this is the knife, and it is a refrigerated microtome. The temperature will be somewhere around -20 degrees. The moment it is kept, it is frozen and we cut the sections. Hence they are called frozen sections. The name of the instrument is the cryostat. It is used for rapid diagnosis. It is used for demonstration of fact. Only two things you undergraduates can remember. This can be a question for you. Even otherwise, when you do answer, you score a mark. What are the stains for fat? Again, a question in fatty liver, a question in lipoma, anywhere. Oil red wool. Earlier I showed you a tumor with vacuolated cytoplasm. Now I am finding that the vacuoles are filled with a red color because of oil red wool. There is another stain called the Sudan black. And Sudan 3, Sudan 4, etc. also are fat stains. A stain called Nile blue sulfate will produce a blue and a pink color depending on the type of lipid. Osmium tetroxide produces a black color. So these are the stains. Please by heart the list of stains. It can be used for a number of questions. Send the list of your slides and specimens to pathodpg@gmail.com so that I can reciprocate. Thank you. And what are the sites of lipoma? This incidentally is a question in surgery. Commonly it is seen in the shoulder, back and the buttock. And what are the sites exactly where we can find a lipoma? It can be subcutaneous, subfacial, intramuscular, parosteal, subsynovial, intra-articular, subserosal, submucous, etc. These are not my words, but by K. Das, Clinical Methods in Surgery. See you in Game 4.